Welcome. I want to review a very important exercise that you could be doing at home on a regular basis. And the advantage of doing this exercise is that we're going to actually indirectly help our posture. And that's very exciting. Understand that everything in the body, from the front part of our body to the back part of our body, must be within balance. If one area is stronger and over-dominating than the other, then we're looking for potential biomechanical instabilities, compensation, and obviously pain and dysfunction. If you look at the lower part of the spine, this is the lumbar spine. It has a normal lordotic, an inward curve. The thoracic spine has an outward curve, and the cervical spine has the same curve as the lower back. But let's focus strictly in the lower back here. If you look at the joints right here, these are called facet joints. And when you lean forward, these facet joints come apart. And when you lean backwards, they come together like this. So when they come together, they're gliding on what we call the apophyseal joint. The joints have synovial fluid. It is a type of a very pain-sensitive area that when there is what we call facet imbrication or sclerosis or hardening of the bone, that particular area can become roughened and become very painful. We call facet syndrome. So the exercise that we're going to do is we're going to do a standing erector extension. We're going to stand up and we're going to extend backwards so we can continue to put mobility in these particular joints. Our goal here is to increase mobility. These facet joints are extremely strong joints, but these are the joints that stabilize and hold up the entire weight of our body and our spine. As these joints become immobile or fixated in a certain area, you then can start getting sclerotic changes, calcium being laid down in the joints, or regularity on the facet joint, which is obviously can be very painful. These are very, very high sensitive, painful areas that in many situations, when your doctor diagnoses you as a herniated disc or a bulging disc, many of these cases aren't coming from the disc, they're coming from the facet joints. So this particular stretch we're going to do is a stretch that we're going to increase extension. The McKenzie method deals strictly with extensive extensor exercises. As we do this, we're going to increase mobility, increase function. Very simple. Take your hands and grab the back top of your pelvis. And as you push your pelvic forward, I want you to lean back a little bit as you push forward. Good. And come back. I want you to go back again, push the pelvic forward and lean back a little more. Good. Okay, excellent. As you go ahead and push the pelvic forward, you're going to lean back a little bit more. Okay. Important tip, if you're having pain radiating into the leg or a very acute pain, doing this particular technique, do not do it. I also recommend before you do any exercises, always get clearance with your healthcare professional. But the purpose of this exercise is as we push the pelvic forward, each time you go a little bit further back, we're doing maybe a total of about 6 or 7 extensive exercises. Now, the very most important thing I want you to gain out of this, besides the mobility here, is this is going to help your posture. You're saying, how? The important postural part of this particular exercise is go back into position again as you go ahead and lean back, pushing the pelvic forward. As you go further back, what I'd like you to do, I'd like you to lift your head to the sky, lift your chest up to the sky, and lift upwards. Stick your chest up and lift upwards. As you lean back, you'll feel those ab muscles really elongate. You're saying, wow. Let's do it again. Okay, lift your head up to the sky, chest up to the sky, lift up high. As you go back, you'll feel those abdominal muscles stretch and burn. You're saying, wow. Well, that's very important because the majority of positions that we're in today is in a seated forward head position, forward rounded shoulder. Our hip flexors are flexed. We're always looking down. Our abdominal muscles are contracted and shortened, bringing us forward all the time. So as we stretch open these particular abdominal muscles with this exercise, we're actually helping our posture. And as we sit up straight and as we stand up right now, you're saying, wow, I feel like I'm about an inch taller. And I want you to tell me if you feel taller, because leave your comments below. I think it's really going to do you a lot of good. You can do this daily, this particular stretch, but most important thing, that if you're having pain, do not do the exercise. Radiation, tingling, burning, do not do the exercise. There are certain conditions where you can inflame the nerve if you've got a herniation or some other instability going on, like a facet syndrome or a sacroiliac problem. This is an excellent stretch, excellent exercise. Don't overdo it. Just do it to the point to where you feel that nice stretch, and continue to do that, and you really will see a lot of good benefits by doing this exercise. Subscribe if you haven't, so you can continue to receive more self-help videos. Share this video with your friends, and most important, make it a great day. I'm Dr. Alan Mandell.